Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up, a major shift in breast cancer screening. For the first time in more than a decade, the American Cancer Society is recommending most women wait until age 45 to get a yearly mammogram. At age 55, they can switch to every 2 years. The new guidelines are fueling the debate on how best to fight the disease. Holly, what is behind these changes?
Right. You know, breast cancer screening guidelines have long been controversial, and that's because the 4 or 5 major medical groups that weigh in on it have never really reached a consensus. This was so striking because it was the American Cancer Society, and they've tended to be more aggressive with their guidelines in terms of screening earlier and more frequently. But as you said, they just slid back the age at which women who are of average risk of breast cancer, not heightened risk, but average, the age at which they should have their first mammogram from 40 to 45. You then have it yearly until 55, and then every 2 years after that. Now, that's still sooner and more aggressive than what the U.S. Preventative Services Task Force says, which is to start at 50, but it does represent a significant shift. The idea is that if you screen based on these guidelines, you're going to catch women who are going to benefit the most and have the least downside from the tests.
So what's behind that change? What prompted them? Did something happen?
Well, this is a literature review based on the latest data that's out there. And let's be clear about one thing. One thing's not confusing. Mammography saves lives. So if you are a woman at average risk, there's a 2.7% chance that you're going to die from breast cancer. That's with no screening. Now, if you do screening starting at 50, that's the United States Preventative Services Task Force, that goes down to 2.0%. So that's a nice drop. Yeah. If you're more aggressive and you do these guidelines to the American Cancer Society, start at 45 every year, that goes down to 1.8 to 1.9% chance. So it goes down a little bit more. The bottom line is, if you're more aggressive, say start at 40, you are going to pick up more breast cancers. You're also going to be picking up more false positives. You're going to have unnecessary testing, unnecessary biopsy, unnecessary worry. So you have to balance the risks and the benefits.
Holly, the American Cancer Society also said doctors no longer need to perform these exams. What's that change about?
Right. So clinical breast exams is when a doctor feels your breasts for lumps. Previously, it had been recommended for all women ages 19 and up yearly. And according to this report, there wasn't enough evidence to show that it significantly detected cancers and that the benefits outweighed the risks of unnecessary testing. I will say this one is particularly hard for me to get my mind around. I have to say, every physical that I do, virtually every physical that I do on all of my female patients, I do a clinical breast exam. I'm not sure I'm ready to make that change.
Well, so then what is the recommendation for both the patient and the doctor if Holly's saying this is something she actually really believes in?
Well, in terms of the breast exam, I think there's going to be some argument about that, not only in terms of the doctor doing it, in terms of the patient doing it, what are the pros and cons? You can pick up breast lumps earlier and then have these false positives. In terms of the general guidelines, what's a doctor supposed to do? So important that this is a personal choice. So they specifically say between 40 and 45, for example, talk to your doctor about it. Now, I'm a gastroenterologist. I do colonoscopies on people, and there are certain guidelines for that. I've found colon cancer in somebody in their 20s.
Right.
That's unusual. Do I do a colonoscopy on everybody in their 20s? No. So it's a risk-benefit thing.
A new report from the American Academy of Pediatrics says expectant mothers should avoid all forms of alcohol during pregnancy. The Academy says, quote, no amount of alcohol should be considered safe. It adds that all forms of alcohol, such as beer, wine, and liquor, pose similar risk. This advice goes against other research that found small amounts of alcohol may be harmless. I remember when I was pregnant, I always felt like what you would hear was later on in the pregnancy, you might be able to have a glass. What has changed that made them say, let's change these rules?
Well, you know, Vanita, really the American Academy of Pediatrics is just reiterating their position that they've held for the last 30 years, which is that no amount of alcohol is safe for women at any point during pregnancy. But I think they're putting this out there because there have been some reports which show 10% of women still drink alcohol while they're pregnant, and 3% binge drink. That's when you have 4 or more in one sitting. And there have been effects from this. A recent survey shows that between 2.5 and 5% of first graders show some evidence of fetal alcohol spectrum disorders. So we are seeing results from people drinking.
It's such an important guideline for women to really have highlighted, too. All right, next up, the man at the center of former New York City Mayor Michael Bloomberg's public health initiatives. In his new book, Saving Gotham, former New York Health Commissioner Dr. Thomas Farley tells the inside story of the administration's fight to transform health in the country's most populous city. Jon asked Dr. Farley about his time in office and what he considers his biggest success, the decline of smoking rates in the Big Apple.
How did you lower smoking rates?
Well, there are several pieces to the strategy. First was raising the price on a pack of cigarettes.
Significantly, right?
Significantly. Right now, a pack of cigarettes in New York City costs about $12.
And at the beginning, it was
maybe $3 or $4, so a big increase in the price of a pack of cigarettes. Then there was a smoke-free air rule.
People pushed back on that big time.
Oh, it was a big political fight. People said no one would ever go to a bar or restaurant again, that people would go to New Jersey for dinner, and we wouldn't even have tourists coming to New York City because they couldn't smoke in a bar.
Any of that happen?
No, as a matter of fact, just the opposite happened. The European tourists saw that it was nice, and the idea spread to Europe, and now most of Europe is smoke-free.
Surgeon General Dr. Vivek Murthy took a lot of heat for saying that gun violence was a public health problem. What do you think about that?
Gun violence is absolutely a public health problem. It's particularly hurting poor minorities all over the country. It's not just gun homicides, although gun homicides are a big public health problem. It's also gun suicides. You know, in New York City, the gun suicide rate is 1/10 the national average.
Why?
Because we have so many fewer guns in New York City than in the rest of the country.
When there is a mass shooting, you hear two things. One is gun control, and then people also saying, well, you need better mental health services, prevention, so that people, when they do have some psychological problem, don't commit violence. Is it both? Is it either?
We absolutely need better mental health services in this country, but it's not going to be able to reduce these sorts of gun events that we're talking about. You know, the difference is whether a gun is available. And the evidence is very clear. The more guns you have, the more gun-related violence you have. In states that have fewer guns, have fewer gun-related homicides and fewer gun-related suicides. So more guns is not the solution to the problem. The solution to the problem is fewer guns, particularly fewer guns in the hands of people who are likely to use them.
You can see more of that interview on our website, cbsthismorning.com. The book, Saving Gotham, is on bookshelves right now. Great conversation.
Unusually candid. I mean, he's not in office right now. He's really speaking his mind.
Very direct. Dr. Jon LaPook, Dr. Holly Phillips, thank you both very much.